And then next, we have your protein electrophoresis, CSF protein electrophoresis. Now, the primary purpose for performing CSF protein electrophoresis is for the detection of oligoclonal bonds. Okay. Now, these oligoclonal bonds, it is usually a representation of an inflammation within the CNS. Now, the bonds of these oligoclonal bonds, they are usually located in the gamma region of the protein electrophoresis, indicating now an increased production of immunoglobulins. Now, when it comes to performing protein electrophoresis class, I want you to remember na to ensure that these oligoclonal bonds are really a representative of a neurologic inflammation, or let's say neurologic disorders, okay, simultaneous serum electrophoresis must be performed also. Meaning, hindi ka lang magra-run ng CSF sample mo, but you always perform it together with the serum sample. And then another important notes to remember when it comes to CSF protein electrophoresis, a single band of an oligoclonal band, usually, kung isa lang, kaya ang ibig sabihin nito, kung isa lang na oligoclonal band ang nakita mo, we usually regard it as a negative result. Negative for what? For a neurologic disorder, okay, or a neurologic inflammation, okay? So, kailangan when it comes to electrophoresis, importante na makakita tayo ng at least 2 or more oligoclonal bonds for a definitive testing. Now, again, ang clinical significance ng ating oligoclonal bonds, it is an indication of an inflammation process within the CNS. Okay? Then, aside from this one, it is usually a useful as an aid in the diagnosis of multiple sclerosis. Multiple sclerosis. Kasi, ang important marker din ng multiple sclerosis natin, usually tataas din ang kanyang immunoglobulin production. Especially yung ating IgG type. Now, what is actually the clinical significance of performing protein electrophoresis? Now, aside from multiple sclerosis, marami pa tayong actually pwedeng ma-diagnose or ma-detect na disorders involving now both the systemic and neurologic disorders. Okay? Now, we have actually 2 different types of oligoclonal bonding. One in which meron yung bonding na makikita lang natin sa CSF but not in serum. And then we also have this type of oligoclonal bonding that are seen in both CSF and serum samples. Okay? Naunahin lang natin ito. Now, the presence of 2 or more oligoclonal bonds in the CSF but not present in the serum can be a valuable tool in the diagnosis of the following. Number 1, we have your multiple sclerosis. Multiple sclerosis, particularly, it is usually accompanied by an increase in what? Increase in IgG index. And then aside from this multiple sclerosis, we also have other neurologic disorders including encephalitis. Okay, we also have encephalitis, neurosyphilis, Guillain-Barré syndrome. Okay, we also have Guillain-Barré syndrome. And then, neoplastic disorders like neoplastic disorders. Yon, yung mga yon. Okay, so we have your multiple sclerosis. Ito lang pala. Okay, multiple sclerosis, encephalitis, neurosyphilis, and your Guillain-Barré syndrome. Okay, now therefore, the presence of oligoclonal bonding must be considered in conjunction with the clinical symptoms of these following disorders. Okay, so wag lang tayo magde-depend sa electrophoresis. It should always be accompanied with clinical symptoms. And then next, we have your serum and CSF bonding. Okay, now disorders such as leukemia, lymphoma, and even viral infections Okay, these are now the disorders that may produce serum bonding, which can appear both in the CSF as a result of blood-brain barrier leakage or traumatic introduction of blood into the CSF specimen. So, itong mga disorders natin, yan ang mga nakikita, or rather, it is usually these disorders, it is usually it is a representation of both systemic and neurologic involvement. Most especially, class, we also have HIV infection. Huwag niyong kakalimutan si HIV infection. Okay? Now, a bonding representing now a both systemic and neurologic involvement is usually seen in the serum and CSF of a person with HIV infection. Now, another CSF marker is we have your myelin basic protein. Now, the presence of this protein, your myelin basic protein in the CSF, it is actually an indication, or rather it is an indicative of recent destruction of the myelin sheath, okay, covering now the axon, okay. So, we can actually say that this this myelin basic protein, okay, it is an indication of demyelination process na nangyayari sa CNS. Okay? Now, the measurement of the amount of this myelin basic protein in the CSF can be used now to monitor the course of multiple sclerosis. Again, ang gamit niyan, class, okay, it is used as a monitoring for the course of multiple sclerosis. Okay? Now, another, ano pa ang gamit niya aside from this one? It may also provide a valuable measure of the effectiveness of current and future treatments for multiple sclerosis. Okay? Ano ang method or technique na ginagamit natin when it comes to measuring this myelin basic protein? We make use of immunoassay techniques. Okay? We make use of immunoassay techniques. Immunoassay techniques.